I'm Dr. Sim Pierce, and today we're talking about the 5 Botox injection mistakes that I see injectors do. Often with the best of intentions, injectors get these things wrong and end up with a higher risk of side effects and complications that you really don't need to have. In the show, I'm going to be going through each mistake, and then I'm going to teach you how to avoid them and how to get better results. And at the end, I've got a special bonus for you that's really going to help you inject more safely and get better results starting tomorrow. This might shock you, but leaving extra safety margins can actually make things much worse.
What?
Take, for example, treating the glabella. When injectors first learn to inject botulinum toxin, they learn quickly about the risk of eyelid ptosis. And we know that the closer you get towards the eyes, perhaps the more likelihood there is of causing an eyelid ptosis. So what many injectors do is they take the normal boundary and just shift it up another centimeter. Now, when it comes to a muscle like the corrugator, if you move a centimeter from where you think that muscle is, you actually move out of that muscle, typically into the frontalis muscle. And this is what results in many new injectors often causing a central brow drop and a lateral brow lift, often known as a spock brow. With the best of intentions, unfortunately, these injectors are causing another side effect instead of just injecting in exactly the right place using an appropriately sized safety margin. Similarly, if you consider the orbicularis oculi muscle, injectors who move further away from the eye can often end up more inferior in the cheek than they should be. This can cause a saggy appearance as you smile, as the cheek is no longer elevated by the lower orbicularis oculi muscle. Or even worse, if you're deep and inferior, you may affect the zygomaticus major, causing a droopy smile. And this leads me to the next more common mistake, which is injecting too deeply. It's very important to learn the layers of the face when you're injecting botulinum toxins, because you can inject the right point according to the diagram and the leaflet that you get with your product, but end up injecting underneath the muscle. So an example could be what we just mentioned with orbicularis oculi and the zygomaticus major. It's very common for new injectors to inject deeply straight through the orbicularis oculi muscle into the origin of the zygomaticus major. This, of course, is a sure way to make sure your patients aren't smiling after the procedure, which is not what we want. The next really common area where depth is important is the tail of the corrugator. So as you're injecting the corrugator muscle to decrease frown lines, if you inject a full depth injection laterally, you actually miss the corrugator completely and you end up right near the foramen, which could lead to an eyelid ptosis. So depth of injection is another common error that new injectors make. And I think it's partly down to how injections are taught in mainstream medicine. We typically don't vary the layer. You put the full needle in and give your injection, be it a vaccination or local anesthetic. There are various situations that we don't have to be as precise as we do in aesthetic medicine. The next common mistake is not recognizing the benefit of movement. Now, patients often push clinicians in this way, and often clinicians simply chase the patient's goal, which is frozen.
Let it go, let it go.
Being frozen does not always mean being more attractive. In fact, quite often it's the opposite. Your face ultimately is a tool for communication and collaboration with others. And although removing negative expressions can aid that process, some of the expressions that you remove are important for building trust. One useful example is a flick of the eyebrows. Apparently, it's one of the key signs that humans look for when you first see someone, particularly from a distance, is that registration that the person that you know has entered the room. It makes people feel there's a small connection there, which then you can build on later. So zero eyebrow movement does mean you're going to have to use other ways of using your face in order to convey that connection. Now, it is perfectly possible to do this, but it's one example of why completely obliterating all movement isn't actually always more attractive, because attractiveness is not about looking like a photograph, it's about the ability to connect with people. The next common mistake is to overlook the benefits of a muscle that's contracting in terms of beauty. So it's very easy to say that you have lines around your eyes, stop the muscle moving, and you will get a clearer complexion with fewer distractions and you'll look more beautiful. The downside is, if you take your orbicularis oculi as an example, it is actually lifting the cheek when you smile. So you can end up with a situation where the patient smiles and they have no wrinkles, but their cheek doesn't rise up, and they therefore look a little bit stunned, which is obviously less attractive. Another interesting example is when the muscle is doing another function. So the platysmal bands, for example, this muscle is an accessory muscle for breathing. It's involved in high intensity exercise, or in rare instances, someone who has COPD, for example, might use this muscle to aid deep inspiration. And if you completely stop that muscle from moving, you could cause a knock-on effect of them not actually being able to ventilate quite as effectively. This effect is more obvious in the muscles that we know are functional, as well as being communication tools, for example, orbicularis oris. It causes vertical lip lines, and if you treat those without considering the impact on the function of the muscle, you end up with a situation where patients can't either drink through a straw or pronunciate certain sounds, particularly the p sound from any letter, any word starting with the letter P. And here's another mistake that you really don't want to forget, even though it's not common at all to meet patients like this. But if you meet someone who has almost got an incompetent mouth, so they try very hard to close their mouth at rest, they're doing this, and they have a popply chin, some clinicians end up treating the chin with botulinum toxin, which then causes incompetence in their ability to close their mouth, and you end up with a mouth breather. Now, it's not a good look, and makes patients very upset if they don't naturally do this. And it happens because we're treating what we see and not considering the function of that muscle. Always remember the function, not just the form. We've been through the mistakes now. Let's consider what you can do to avoid them. Consider the safety margins first. I always say it's a really good thing with a new injector to start to learn about the impact of injections, even in places that you don't think you'd ever want to treat. This shows real understanding in the face. So as you move away from an area that you want to avoid causing a side effect in, you're always moving into another area. And that other area will have other structures which can absolutely be affected in some way. So always brainstorm, what is the risk that is increasing as I'm moving away from the risk I'm trying to reduce? Because there's always another one. Even if it's just wasting your product, that is a risk to your patient. They're going to have to pay for more to get the same effect. And if you always ask yourself these questions, you will develop a deeper understanding of the face and inject appropriately and realize that everything is a balancing act. There is no absolute safe position. You're always just bearing the risk and compromising one way or the other. We're looking for the best possible compromise with our patients, where you get the best result with a minimum set of risks. Next, let's consider depth. So depth obviously starts with understanding the anatomy. It's really a good idea to spend some time understanding the layers in the places where you tend to inject. We tend to be dealing with, just broadly speaking, skin, a thin layer of fat, the muscle that you want to inject, and then sometimes fat underneath that, and sometimes in the face in particular, another muscle underneath that. So you need to know which muscle you're aiming for, whether it's in the more superficial plane or a deeper plane, and which other structures are nearby. When you understand this, the next step is to start to really understand your needle length and which different positions in the needle correlate to different positions within the face. I think it's quite easy just to think about injections as either deep, medium, or superficial. And that covers most of the situations you may face. For example, if you take the corrugator muscle, where we're trying to avoid injecting into the orbit, laterally, we know that that muscle inserts into the surface of the skin. So that would be a superficial injection, which you would do with the first 1/3 of the needle. If you take the other side of the muscle, the deep part of the corrugator, we know that that's a deep muscle near the bone. So we know that we want about 2/3 of the needle placed into the skin. So this is a great example of how you can know the length of your needle, whether it's deep, intermediate, or superficial, and how you can vary that according to where you believe the muscle is that you're aiming for. The next problem we need to solve is about appreciating the attractiveness that comes with movement. We don't all need to look like photographs to be attractive. There's a lot to be said for the little movements that you can do that garner someone's connection and attention. So the first way to do this is to start appreciating it yourself as an injector. Movements matter. It's also important to bring this story to your patients. Many patients think the best Botox is the most frozen result, and they fixate on being frozen, which is understandable because then you look like a photograph. You have to essentially sell them the benefits of some movement and explain that your face isn't just about looking like a photograph, it's about connecting and forming trust and building relationships. That is what the most beautiful people are able to do most easily, is because they are not able to just attract people but also connect with them. We're always trying to do both of those things at once. And a good clinician will explain that to patients and help them deal with the compromise that we're always making between looking, as I say, like a photo, rather than someone who you can connect with. And we need to try and get the balance just right. Next, let's consider how to preserve the function of muscles. Now, part of this is simply about consulting your patients to accept moderate improvements rather than complete results. It doesn't matter which muscle we're treating, be it for a gummy smile or orbicularis oris or the masseter muscle, we always have to have some movement as well, and we can't simply freeze to get the aesthetic result. What has worked quite well with me is describing the function that they may lose in order to avoid them hoping for the perfect aesthetic result at the expense of function. So a big part of this is about communication, and communication starts with you understanding that all of these muscles, particularly in the lower face, have functional components as well as aesthetic or communicative components. It makes sense a bit more in other parts of the face that you can treat a little bit more heavily, but where there is a function to the muscle, we must be very, very careful and make sure that we're balancing that function with the reduction in a way that still works as an overall healthy picture. So I hope you've enjoyed this video. It should have helped you understand some of the common mistakes people make when they're trying their best through a lack of a little bit of understanding here and there. So now that you understand better how depth and safety margins can go wrong, I hope you'll be practicing safer starting from tomorrow. And we've also included that free download view so that you've got a visual reminder of some of what we have discussed. If you're interested in this topic, you will love 2 other videos that I've also got on injecting better with botulinum toxins. We've got one that's especially for the older patient, and another one that you can watch is a tutorial just about how to inject botulinum toxin in small foreheads. I'm sure you'll find it very interesting if you haven't seen them already.